Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. All right, so I'm super excited to have my friend and colleague back, Abby Vallejo. She's here with me today. We're going to talk about thyroid, all things thyroid when it comes to hormones, when it comes to gut, and just kind of a really nice overview on the function of the thyroid, how it works, and why it's important if you're struggling with chronic illness. So, Abby, let's kind of dive into just the symptoms of low thyroid, because I think that's a good place to start. A lot of people probably are having several of these symptoms and might not even realize that their thyroid might be a piece of their health puzzle, right?
Yeah, absolutely. I think this is such a relevant conversation because thyroid is, especially for women, is something that affects women and, is often underdiagnosed. Like how many women are walking around with clear thyroid symptoms and they don't know it, right? So, yes,
Yeah.
let's dive into that. So, fatigue is a big one. So, if you're walking around, you have a lot of fatigue. Weight gain. So if you're having trouble losing weight, or you're putting on the weight and you're just feeling like it's not coming off no matter what you're doing, thyroid might be a piece of the puzzle if you have low thyroid function, because your thyroid is intricately linked to your metabolism. And so if your thyroid is not functioning optimally, neither will your metabolism be.
Mm-hmm.
Cold intolerance is another really big one. So are you cold all the time? Even when you shouldn't be cold, even when no one else is cold? Or do you just get so cold you always need like an extra layer? It could be a thyroid issue.
Mm-hmm.
Another one is dryness. So if you have like really chronically dry skin, dry hair, dry eyes, it's just like this picture of dryness is often a common low thyroid function issue. Another thing too is going kind of zooming in on the hair a little bit. You can usually tell when someone has a low thyroid issue going on because they kind of just have this particular look with their hair and their eyebrows. So the hair tends to be like very, very sparse. It's often brittle. Usually these people have short hair because it tends to really break off. I feel like most of the clients that I see that really suffer with this before we, get it rebalanced, it just kind of has this like wispy kind of windswept look where their hair just kind of like brittles away into nothing because it just breaks off. And then if you look at the outer third of the eyebrow, often that's completely missing. The eyebrows get really thin and then that outer third can be missing. So that's a very common, like if they look dry, they're missing that outer third of the eyebrows and their hair is just really brittle and thin and wispy. That's kind of a dead giveaway to low thyroid function. Another big one can be mood. So, if you're dealing with something like depression or low mood, the thyroid is intricately linked to that as well. And so that is a common one that we see. And that, often, women will go in and they'll be dealing with depression and the doctor will be like, great, here's an antidepressant, rather than, oh, should we check your thyroid? Should we check your hormones and see what's the underlying driving factor as to why this is happening? Right. Constipation is another big one. So if you have sluggish digestion and poor gut motility, basically meaning that it takes a long time for food to get through your system, leading to something like constipation because you just have a backup going on, that is a common symptom of low thyroid function. Brain fog is another one. So
Mm.
if you're just like, basically it's an overall picture of sluggishness in the body and the brain is
Mm.
included in that. So if you're like having trouble remembering things, the cognition is kind of slow, that brain fog, that can be related to thyroid as well. A slow heart rate is another one. Aches or muscle weaknesses can be another thing that can happen. And then like a picture of puffiness, right? Because again, going back to
Yeah.
that stagnation, you're not getting like good drainage. And so you might have like a puffy face, just kind of an overall issue with like weight and puffiness. I think are the most common things that I see related to low thyroid function.
Yeah, that's such a great comprehensive list and definitely some things in there that I wouldn't necessarily remember right off the bat. So you did you did a good job going through
Thank
all that,
you.
Abby. Yeah, and I think just to kind of fill in a little bit, one of the common things I think I hear from a lot of my female clients, and granted, I'm working with a lot of gut-centric people who are struggling more so with like overt gut symptoms, is they'll say like, yeah, and another thing, I see so much hair in the drain after I take a shower, right? Which kind of gets to
Yeah.
your point of like the thinning visibly,
Yep.
but I think and I know too, as a person who has had low thyroid and it has come as a progression of my own gut disorders,
Mhm.
that was one of the first initial clues, along with feeling more unusually cold than I knew I should have been at the time. It was like, oh my God, my hair is coming out in chunks
Yeah.
and just
Yeah.
feeling like there's so much hair loss. So,
And that's hard to
um,
ignore. So I feel like that's often the symptom that women will come in and
yeah,
say, because that's a very in your face. Maybe we can deal
yeah,
with being cold all the time. And a lot of times we just think, oh, this is normal. I'm just always cold all the time. But when your
yeah,
hair starts falling out and you see a ton of it in the drain more than usual, it's like, okay,
that's scary.
something's really wrong here.
Yeah, that's scary, and, like, Abby and I both live in Wisconsin, which can have a really cold climate, especially at this time of the year in the winter, and
Mhm.
so it's easy to just be like, "Well, we keep our heat low," and so we just put a
Yeah.
few extra layers on, but
Yeah.
I love your point about just even checking in with other members of your household, and it's like my husband and I do this a lot too, it's like, "Hey, are you cold?" And now granted, he's got a higher threshold, and I find men in general tend to
Men
run a little
usually
bit
do. So
warmer.
check in with
Yeah,
another woman. Don't
woman.
necessarily check in with a man
Yeah,
because men tend to be like
yes.
heat radiators and we
It
as women run a little bit colder than they
colder.
do.
Yes,
But check in
yes.
with another woman. Like, is it really that cold in this room or is it just me?
Totally, totally. Because it can be, like, easy to write that off to, like, "Well, it's cold and we keep our heat a little bit low," and maybe
Mhm.
that's true, but maybe
Mhm.
the truth is your heat is pretty appropriate and you
Yeah.
actually are running colder because your
Yeah.
metabolism is
And you might be
downregulated, so
cold year round. Like I feel like a lot of the,
yes.
people that have issues with thyroid, they're cold all times of year. Now, granted, if you're outside on a 90-degree day, maybe not then, but it doesn't necessarily only happen in winter. You probably have common frequent occurring times that you're cold all year round.
Exactly. If you're wearing long sleeves indoors in the summer to stay
Mhm.
properly,
Mhm.
like, heated, there's probably something wrong there,
Yeah.
unless you're blasting your AC or
Yeah.
something, right? So, yeah,
Exactly.
and then to the sluggish bowel piece, I just wanna fill that in a bit too, because I think sometimes people don't even realize that not having one bowel movement a day at least is abnormal. So, like, if your norm lifelong has been you only have a bowel movement once every 2 to 3 days, that,
Mhm.
by the way, is sluggish bowel
Oh, yeah, and I'm
syndrome.
glad you brought that up because
Yeah.
sometimes, I've learned how to ask these questions because in the beginning, maybe you're asking a person, "Oh, are you regular?" And people are like, "Yeah, I go regularly every 2 or 3 days." And I'm like, "That's not regular." You might be doing that over and over regularly for you, but that's not normal. You should be going at least once every day, like 1 to 3 times daily is
Yes.
normal. So if you're going less than that, it is considered constipation, even if you are going regularly. So,
Yes,
yeah.
yes, and we'll kinda dive into some of the underlying factors that can drive thyroid imbalances, like, as we progress in this conversation, but just to kind of preview that a bit, this is a bit of a chicken and egg with this, but the less you poop, the less you're able to eliminate toxins that you're coming into contact with every day, and so what can happen
Mhm.
is this buildup will start to happen more and more in the body, which can then impact all of these other glands and tissues and systems,
Yep.
including
Yep.
thyroid, so it becomes this chicken
Yep.
and egg problem where
Exactly.
we really wanna keep things moving. We wanna be pooping at least
Yep.
once daily, preferably more than once daily, right? So it's yeah, such a great list, Abby. I'm really glad you touched
Thank
on all
you.
those things. So let's
Yeah.
talk a little bit about, and I want you to get into this because I know you just did a mini thyroid class on your podcast not long ago, kind of just a bit of a teaching as to how does the thyroid work from the brain all the way down. So if you wanna
Oh,
kinda dive
yeah,
into
yeah,
that.
I love
Yeah.
explaining this because I just realized, like, over the years, I've gotten a lot of thyroid patients coming in, and I'd start talking about, I'd throw out like T3 or reverse T3, and they'd kind of get this look like, what is that? And even though they had a diagnosed thyroid condition, and so I started asking, like, were you ever taught how the thyroid works? And that, no, no, I never got anyone that was like, oh, yeah, I was taught this. So it just occurred to me, like, okay, you have this condition. Let's get you understanding in simple terms, like how the thyroid actually functions, so you can understand, like, why we need to do certain tests and support certain things and why maybe just measuring TSH isn't enough, which we are going to dive into next, but let me like break it down first. So
Yeah.
I like things in really simple terms. We're going to keep this super simple. So the thyroid kind of has a chain of command in how it works. And it doesn't actually start in the thyroid. So for anyone who doesn't know, the thyroid is a butterfly-shaped gland in your neck. So if I'm pointing to my neck, I'm pointing to my thyroid right here. But it doesn't even start there. It actually starts up here in your brain. And it starts by your brain sending a signal. So that's TSH, thyroid stimulating hormone. It sends a signal to your thyroid saying, hey, 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 make thyroid hormone. So sometimes I draw this out on a whiteboard. So I'll draw a little brain and then I'll write TSH. I'll draw a little arrow and I'll be like, it's poking the thyroid and it's saying, hey, 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 make thyroid hormone. That's the first step of the process. Then what happens if the thyroid responds appropriately in the thyroid, it will make T4. So T4 is inactive thyroid hormone. So the thyroid has responded. It's made thyroid hormone, but it's made a version of it that's inactive. So far it's not doing anything. It has to get activated before it can actually go out and do its job. But that part of the process has to be in place, right? So step 1, TSH does the little poke. Step 2, the thyroid responds. It makes inactive thyroid hormone, which is T4, which you can measure on a lab. So then how does it get activated? Well, you'd think that that would probably happen right there in the thyroid, right? Well, most of it doesn't actually. Most of that activation actually happens down in the liver. So that T4 gets sent to the liver and it gets activated. And when it gets activated, that changes from T4 into T3. That is active thyroid hormone. So if someone has liver issues, they might have a thyroid issue, secondarily. It might just be coming from the liver, but the liver has to be functioning optimally for your thyroid chain of command to be able to be flowing appropriately. So once you've made that active thyroid hormone, now it's ready to go out to your cells. And this is how hormones work in the body. They're like little ships sailing at sea, and they have to go and dock at a port and bind. And only then can they actually do their job, right? So thyroid hormone is no different. So that T3 has to get sent out to your cells in your body. It comes to the cell, it docks, and then it delivers its message and does its job. And that's where the thyroid, does the things that it's known for, like regulating your heart rate or your metabolism or your body temperature, things like that. So that full chain of command has to be working. So that's basically 4 steps. Like I said, like to keep it real simple. The brain making TSH, poking the thyroid, right? That's 1. Then 2, the thyroid responds by making inactive thyroid hormone, which is T4. Then step 3, it goes to the liver, it gets activated into T3, which is active thyroid hormone. And then step 4, it's ready to go out and bind to the cells and actually go to its place of work, right? And go do its job that it's meant to do. All of those things have to be working in order for the thyroid to be functioning optimally.
Yeah, absolutely. No, that's a beautiful explanation, Abby. And I think this kind of leads us into talking about why it's so important to look at multiple markers to really
Mm-hmm.
get a true sense of how is your thyroid working because
Yes.
we can talk about this and we have talked about this actually in other episodes we've done on your podcast and mine where commonly what'll happen is if someone goes into their doctor, the doctor does tend to suspect something is up with the thyroid,
Mm-hmm.
they'll run just the thyroid stimulating hormone marker only, which you can
Yeah.
check via blood, TSH
Yeah.
only.
Yeah.
And then this is like a two-part issue here, so their actual like range of acceptable limit for TSH of course is quite high. It has a high
Mm-hmm.
so
Yeah.
part of the issue could be even if TSH is starting to elevate based on what we in functional medicine would consider a more optimal range, it
Mm-hmm.
still has to cross that threshold that they
Yeah.
would consider like critical
Yeah.
for them to say, oh, yeah,
Yeah.
we have an issue. But not only that, they're not looking at these other thyroid hormone components that Abby just went through, like the free T3 and the free T4. And so
Oh, yeah.
let's
You have to
talk a little
look
bit
at
about
the
that.
whole chain. And it's also
Yeah.
like it's a feedback loop, right? So I feel like we should
Yes.
mention that. So when your body is making adequate amounts of T4 and T3, your TSH is going to be low because you don't need more stimulation, right? But
Exactly.
if you're
Yep.
not making enough, your TSH is going to go up because you need more stimulation. You need more pokes for the rest of the chain of command to respond. And so when they look at TSH, so ideally you don't want your TSH to be too high. It's an inverse relationship. So if your TSH is really high, you have low thyroid function. It's kind of like just that basic. So it works that way. So that's why, when you're saying for the listener, like when Courtney's saying, as it starts to rise, well, it's because it's that negative feedback loop. Like your functionality is going down and that's why TSH is going up. So, just looking at that in of itself, it gives us a pretty good guess like, okay, yeah, TSH is going up, so functionality is probably going down because we need more stimulation. So the body's, ramping up that call to action. However, we haven't measured the whole rest of the chain. We don't know what's going on. If is it actually getting activated? Is it going to the cells appropriately? And, to your point, in conventional normal allopathic medicine, the way that they determine the normal range on a lab, so if you go and get labs done, they always have the normal range. And the normal range is literally 95 out of 100 people. They discard the 5 outliers and they say these 95 people here are considered normal. Well, show me 95 healthy people this day and age, right? No, that's not
Exactly. You
optimal.
don't see
Normal
that.
is not optimal. So we in the functional world, we use a much tighter range because that is what's optimal rather than what's normal. So you can be, and I've seen this, and I'm sure you have too, Courtney, multiple times where women or clients will come in and they have clear symptoms of thyroid issues, and yet they still fell within that normal range because it's so broad. And the doctor was like, no, you don't have a problem. But they actually do. And if you looked at the optimal range, it would show they're not in that optimal range.
Oh, for sure. And by that sort of feedback mechanism you were mentioning, I think the most common thing I see show up on like lab testing, right? So we're talking about a complete thyroid panel that looks at TSH, at least free T3, at least free T4, and then at least antithyroid, the ATPO antibodies, and ideally, hopefully, antithyroid globulin antibodies as well. But I often see commonly either lower than optimal free T3 and
Mm-hmm.
or also lower than optimal free T4, and TSH is actually still within a pretty acceptable limit, I would say, even by
Mm-hmm.
functional standards. And the
Mm-hmm.
reason that's happening is because, as Abby explained, typically those free components are going to drop before the brain starts to recognize, holy crap, like
Mm-hmm.
now we
Yeah.
need to actually poke the thyroid more and increase TSH,
Mm-hmm.
versus the reverse where you see a high TSH and free T3, free T4 are normal. Like I almost never see that type of
Yeah.
situation going on,
Yeah.
right?
Yeah.
Yeah.
Yeah. It does take a while for that feedback loop to come all the way back around. But I think
Yeah.
now that you brought that up, we should talk more about like what is a full thyroid panel and why.
Yes.
So I mean,
Yes.
obviously now you guys have the understanding of why just TSH alone isn't enough. We need to measure like that full chain of command. So Courtney, you were kind of starting to list off some things. So when people ask me like, oh, well, I shouldn't just get TSH measured. Like, what should I get measured? So I think let's run through that again, just so everybody has it down. So, of course, they're always going to measure TSH. That's
Yep.
just a given. You want your T4 measured, and
Mhm.
you can get T4 and then free T4. So if you don't get confused by that. It really just with hormones, there's the unbound and there's the bound. So free just means what's free floating in your blood and that your body has access to. So TSH, T4, free T4, T3, free T3. The free is the
Mhm.
ones that you really want to see. I just want to interject here. If you are like really struggling with weight loss and like metabolism is an issue for you, you want to get your free T3 measured because that is a direct correlation with your metabolism. If that is lower than optimal, you could be having weight loss resistance. So that's a really important reason for you to advocate for getting this measured, right? Then there's something called reverse T3. This is metabolically inactive. It's actually T3 already, but it doesn't function properly. So here I always give the example like, so just to keep it really simple, T3, when it's active, it has to go to work, right? And what do you do when you go to work? You probably get in your car, you probably drive to your place of work and you park in the parking lot and then you go inside and you can do your job, right? Well, what happens when the body starts making too much reverse T3 is it goes and it occupies all those parking spaces. So you as T3, you get there and you can't park and then you can't go into work and do your job. So that's kind of what happens. Reverse T3 will actually occupy all the space on the outside of the cell where the active form should be binding, but it won't be able to bind because this reverse T3 is there. And that can be in cases of like chronic inflammation in the body or indicative of other issues going on in the body that need to be addressed if these reverse T3 levels are high. Then antibodies. So we haven't really talked much about the autoimmune component. but it is quite common to have an autoimmune component of thyroid issues. So with low thyroid function, with hypothyroid, that's Hashimoto's. So you can have just a low thyroid function, but you can also have low thyroid function with autoimmune, and you can also have hyper or overactive thyroid function and autoimmune. And on the other end of the spectrum, that's Graves' disease. It's just less common. It's much more common to see low thyroid function and Hashimoto's. So measuring those antibodies is really important because we want to make sure that you don't have that autoimmune condition going on, and or if you do, you want to make sure that your antibodies aren't too elevated. So they're called TPO and TG antibodies are going to be the ones that you want to get measured. And then I always say get your iodine levels measured too, because iodine is so important for thyroid function. You literally need molecules of iodine to make thyroid hormone. And, so often people are deficient in iodine, especially where we live in the Midwest. Like it's kind of, we don't eat a lot of seafood and seaweed and things like that traditionally. So people do tend to be deficient in iodine. So it's a really good time to just get your iodine measured, because if you're deficient in iodine, it's quite likely that's playing a role in whatever thyroid issue is going on.
Exactly. No, 100%, Abby. Yeah, and even just thinking about the soils and, just some of the iodine that is closer to kind of ocean proximity, right? Like all of our produce grown here
Mhm.
would be less iodine, dense, if
Mhm.
you will, than say like
Mhm.
closer to the ocean. But and it's actually a very cost-effective test to run. Like as part of the root cause testing, I will
Mhm.
often add on like
Yeah.
just a urine spot test where really the main thing is if you're going to go ahead and do that testing, hopefully with a functionally trained practitioner, you want to make sure to get a really clean read. You're not taking any supplements that are
Mhm.
containing iodine because it
Mhm.
doesn't stay in the body all that long. Like it doesn't take long once you go off it to get a pretty true read of what your body's literal stores are. But yeah, when I've run that test, I think I've seen every single person come back
Yeah, I
like
test iodine
mentioned.
as well, and it's rare that someone is not low.
Yeah,
So, yeah, I think it's definitely important to I always add it in when I'm doing a full thyroid panel. So what
I
you
would
said,
too.
if you go to your conventional doctor and you ask for a full thyroid panel, you probably won't get it, honestly. Normally, what I see is if someone has a thyroid diagnosis, they'll be willing to run T4 and
Yes.
TSH.
Yeah.
Otherwise, they'll usually only run TSH, even if you insist, and they'll usually say your insurance isn't going to cover this, so I'm not going to run it. So, if you do want a full thyroid panel, it really is better to go with a functional practitioner like Courtney or I, and someone who works outside the confines of insurance, so that you
Mhm.
can get the full testing that you actually need, so we can do something impactful to actually heal your thyroid.
Yeah, no, 100%. I agree with that full on. And yeah, I've rarely found cases where I've had clients come in who have had it recently done by a doctor willing to do it, or have a doctor at their disposal willing to
Mhm.
do that. It typically takes a functionally trained practitioner,
Yeah.
or a very flexible, open minded, conventionally trained
Yeah.
practitioner who's
And
willing
some
to
of
do
them
that.
are certainly out there, but I would just say 9 times out of 10, they probably won't run more than a TSH unless you have a diagnosed thyroid condition. Like for clients that have Hashimoto's, which is the autoimmune, I have seen the doctor occasionally run a T4, maybe a T3, check the antibodies, but it's not something that they usually offer to the standard person. So just something to be
Yeah.
mindful of.
Yeah. One other thing I just thought of, Abby, that I wanted to add in as we're talking about just the full thyroid panel and the antibody Hashi's component is that I learned this as part of my training that, it's thought that upwards of like the vast majority, I don't want to give like an inaccurate percentage, but something
Mhm.
like 80 to 90% of like functionally low thyroid cases have a like autoimmune thyroiditis component to them,
I've
even if
definitely
those
heard that.
yeah,
Yeah.
even if those
Yeah.
ATPO, ATG antibodies aren't elevated because from what I understand, it's actually really better to use like ultrasound technology to really go in and look, is there active
Mhm.
damage inflammation at
Yeah.
the level of the thyroid? Like that's actually a more specifically diagnostic method for
Mhm.
determining that or ruling that
Yeah.
in. And I find that so interesting because when we look at just like data we can look at with different autoimmune conditions across the board. I mean, first of all, it can be so hard in a lot of these conditions to definitively pin them down,
Oh,
especially
yeah.
by conventional
Yeah,
standards,
for
right?
sure.
But even in the functional world, like we can't 100% like rule it out
Mhm.
completely if
Yeah.
we run the panel and those ATPO are below like the threshold is typically around 10, right? For both
Mhm.
of those, maybe 20 for
Mhm.
ATG.
Mhm. Yeah.
I would still suspect that if it's not, they're not there already, they're on that continuum moving that direction.
I'm
Yeah.
glad you said that too, because it can take months really for these antibodies to show up. Either way, right? For them
Yeah.
to get high enough to be flagged when the damage has already been done and has been going on before it'll actually get detected, versus when we start to turn that picture around and start to heal the thyroid, it can take months on the other end for those antibodies to come back down, which is a common thing. So, the person will
Yes.
start feeling better, will start kind of getting their thyroid back on track, will retest, and their antibodies might still be elevated and they're like, oh my God, what's happening? But those antibodies can take a long time to shift in either direction.
Yeah, absolutely. And I love that you say that because I feel like I have that conversation fairly regularly, especially with my more complex client cases
Mhm.
where we're moving all the way in the direction of, say, doing like an autoimmune paleotherapeutic diet, which is
Mhm.
shown research wise to really help support lowering antibodies just across the board in all autoimmune disease. But the thing of it is, with IgG antibodies, they can stay elevated for 3 to 6 months before they come
Mhm.
down, right?
Yeah.
And
Yeah.
so that's true with these other tissue-based antibodies. I mean, we'll talk about the role diet plays a little bit later in this conversation, but just to say that this isn't one of those things where you're gonna, start taking thyroid support and it's like 2 weeks later, everything's
Yeah.
all fine and good. No,
No,
no, no, no, no.
no.
It
I always
takes.
tell people, and this is maybe a little oversimplified, but I always tell people across the board, like at least 3 months, at least three
Yeah,
months. Now you might
yeah,
start feeling better before that, but give it 3 months before you even start thinking like, okay, am I actually starting to see some improvement? And then
totally,
probably 6 months, right? But three
totally.
months is kind of like the minimum. If you've done something for 2 weeks, probably not going to really feel and see a ton of difference in the body, right? Like
Right.
hormones don't shift that fast. Most of the time it's the long game, which is why it can be frustrating, but why it's also why you really benefit from someone who is informed on these topics and can kind of hold your hand and guide you through it so
Yeah.
that you don't give up halfway when you are in fact on the right track, but just not seeing the full results yet.
Oh, for sure. Yeah. And this is a topic I will do a deep dive on at some point, just because I think it's so critical for people to have what's the word? Like that education or just that like preparation mentally that
Mhm.
like,
Yeah.
most of the times they come to us, they've been ill, they have not felt well for a very, very long time and they're desperate. And we can
Yeah.
relate to that, Abby. We've both
Yeah.
been there, right?
Yeah.
But the reality is, if you're going to buy into a holistic approach, you have to have extreme patience. I mean, you really do.
Gotta
Even if
give
you're
it time to
doing
work.
yeah, even if you're doing everything right, like whether
Mhm.
it's a dietary approach or a supplement-based
Mhm.
approach or both, it's
Mhm.
still gonna take some time, and I
Yeah.
think that can start to call up these, like, doubts and just these
Mhm.
frustrations, and it's like, "I've been
Yeah.
at this for a month, I've been at this for 2
Why is
months,
it not working
it's
already?
not working,
Yeah.
right?" And I mean, you should be feeling actually better and better. It's not like you're not gonna feel any difference in a month or
Mhm.
2, but to
Yeah.
get the kind of results you're looking for in a month or 2, that's
It's
not often usually the
right.
case. It can take a
It's
lot
not.
longer than that.
And I feel like I'm always reminding people like we live in a very fast-paced world, in a very modern world, but that is our technology. That is not our bodies. We still have
Yes.
bodies that our primal ancestors had back from the caveman days. Our bodies
Yeah.
still work the same way that they worked back then. It's our technology that's modern, not our bodies. So when it comes to your body and your health, you can't act like it's your computer that just needs an update and then boom,
Right.
there it goes. Like it's not, it does not work that way. I hate to say it.
Oh, god, no, and then people forget how long they felt crappy before they
Yeah.
felt really crappy and were
Mhm.
motivated to go to the
Yeah,
doctor, right? There's all that time
yeah,
leading up to,
yeah.
"Oh my god, I have a problem now, I need to
Yes,
go to the doctor." And then
yes,
how long do you dink around going to
right,
5, 6, 7 doctors, finally
exactly.
get frustrated with that, and you're like, "This is not working. Now I'm
Mhm.
gonna, like, look at functional medicine." That
Yeah,
can be years, right? So,
yeah,
I think just giving us a little bit of, like, leeway in terms of, like, this is super important just to go back and really consider like the process of getting sick was not a short
mhm.
process. So the
Right,
process of
yeah,
getting well is not
yeah,
going to be a 2-month process. It can take a long time sometimes, right?
yeah, yeah,
Yeah.
yeah, you lived into it, so you gotta live out of it.
100%. 100%.
Mm.
Are your struggles with bloating, constipation, and diarrhea keeping you home on Friday, Saturday nights, clicking through Netflix because you're dealing with stomach cramping? Or simply need to have a bathroom nearby? Have you stopped being active and joining your friends at the gym because it flares your symptoms and wipes you out for the rest of the day? How about avoiding social gatherings involving food because of extreme anxiety over food reactions or sudden bathroom runs in public? or because you are too embarrassed to explain your limited diet to others. The isolation, loneliness, and depression that comes with an IBS or IBD struggle is real and often worse than the physical symptoms. I'm here to tell you that you deserve better than just living with this reality and suffering alone. From a person who has lived this nightmare and come out the other end and who has helped many others do the same, there is hope and you are worth the investment. Click the link below to schedule your free 15-minute gut check call. Let's
Mhm.
talk a little bit about the important nutrient cofactors to support thyroid because we kind of started to touch on iodine a little bit. Maybe
Yeah.
we should talk a little bit about like selenium even as well, Abby, because that's such a critical one to help get
Yeah, we
iodine into the
absolutely
tissue.
should. Yeah, let's
Yeah,
mention those. I think I just want to like pause on iodine here for a second because I know that there's like this big debate out there
there
about
is. Yes.
is should we be giving iodine? Should we not be giving iodine? And I kind of have a two-pronged answer to that. And my first one is just logically, you need iodine to actually make thyroid hormone. Like it's one of
Mhm.
the molecules
That
that
makes it.
makes it. So I
It's
think that pretty
it's the
much makes
four.
yes.
Yeah, it's the
It's
four and
yes.
the three in the
Yes, it's the
T4
4 and the
T3.
3 and the
Yes.
T4 and the T3. So
Yes.
I think that pretty much makes the case that we need iodine. Like I just kind of think the argument ends there. Now,
Yes.
getting more nuanced is how much iodine do we give? And obviously that depends on the person, but the thing that I really want to insert here is that giving super high mega doses of any one nutrient alone usually is not a good idea unless we know very specifically that we have, a very specific deficiency. But we don't find things like that in nature. So, what I tell people is I think the reason that a lot of people out there are against iodine is because they've seen the effects of someone getting mega dosed with a ton of iodine without its supporting cofactors to balance
Right.
it,
Right.
and then there's negative effects that way because you don't ever find just one nutrient alone in nature in a megadose. Nutrients always have their friends with them, right? They have what we call supporting cofactors to make sure that they get balanced, they get absorbed properly, right? And that's
Exactly.
what keeps them in check, makes them function properly in the body. So, do I always give iodine to thyroid patients? Yeah, like 9 times out of 10, I do because, like we said, you literally need iodine to make thyroid hormone. However, it needs other cofactors, like
Mhm.
tyrosine, like selenium, which you mentioned. So selenium is so important. And one of the things that selenium is really known for is, especially in cases of autoimmune, it helps keep those antibodies in check and helps actually
Mhm.
bring them down. So for people, and so I feel like higher levels of iodine are often a bigger concern when there's an autoimmune component, because if you just mega dose a person that has Hashimoto's with iodine, it could kind of activate their antibodies, and it can actually kind of make things worse or a little more aggravated, even that they still need the iodine, but it's just the
Right.
iodine alone. So if you add in other supportive cofactors like selenium at the same time, maybe a little lower dose of iodine, you bring in the selenium to help balance it. Now suddenly, that helps support bringing the antibodies down instead of aggravating them. So knowing these other cofactors are really important. So I always think selenium, I think tyrosine, zinc is another one. Even vitamin D is another one. Important nutrients that we need
Totally.
to, make sure that we have enough of. And so many people have like vitamin D deficiencies, right? So
Yeah.
making sure that we don't have these other underlying deficiencies, and that we get, when we give things like iodine, we give the supporting nutrients that go with it to make sure that it functions properly in the body.
Yeah, for sure. I know when I read David Brownstein's book, Iodine, Why You Need It, Why You Can't Live Without It, he has like a whole kind of like list of things to
Mm,
make sure are on board before you
yeah.
start bringing in iodine. And, he even mentioned cases where sometimes people have trouble getting enough like vitamin B1 and B2 specifically, which can help like get thyroid or get iodine, effectively like convert or transport it into the
Mhm,
tissue of the thyroid, as can
mhm.
selenium.
Yeah.
And then I know magnesium was one and
Mhm,
vitamin C was another one. And I think with selenium and vitamin C, they both play a role in the case of selenium, contributing to making glutathione, which is the
mm,
body's master antioxidant, which helps to combat inflammation and, tissue damage and, is really the active force against all manner of pathogens and toxins in the body to try to
mhm.
neutralize those things, get rid of
Yeah.
them. And then with vitamin C, it's so potent in terms of like fighting oxidative stress, right? And so
Mhm.
like you're saying, Abby, it's like with iodine, if it isn't given with these cofactors, it could then create more oxidative stress and
Yeah.
inflammation. And
It
so
could,
it
especially in
could.
autoimmune cases. But at the same time, I mean, I do like to dose iodine higher in some cases. I'm
I
definitely
do.
not against that. I mean, I take like, I think 6.25 milligrams of iodine on a daily basis because that's where I feel optimal. I'm also taking the other cofactors along with it. Um,
Exactly.
but yeah,
Yeah.
that to me, that's where I feel really good, and I've noticed like I used to be the person that was cold all the time and had that really like dry picture of like dry hair. And, I never got to the point where I was missing my eyebrows, but I think it was like a subclinical thing where it wasn't like a full blown, if I had gone to the doctor, I doubt it would have gotten diagnosed, but I feel like it was kind of just like a little bit of, imbalance going on, a little bit of underfunctioning of the thyroid. And so I noticed, when I did bring in the iodine, that made such a difference for me in my skin and my hair. I mean, I can just tell.
Oh, for sure. Yeah. And that's where kind of too, I think this is where the debate in functional medicine is really kind of there. And it's interesting because, as an FDN-P, we had an entire training done by a practitioner that was totally anti I watched Brownstein and Berkson give their whole
Yeah.
spiel, right?
Yeah.
And it's like
Yeah.
there's such polar opposites, but
That's why I'm just like, well, yes. I mean, I know it's always it's good to, listen to differing views and,
yeah,
however, I just think it comes back to like you literally can't make thyroid hormone without iodine. So we
right.
can't just discount it. And there is
Exactly.
really solid research showing how beneficial it is, even at higher doses. So we need to take that
Yes.
into account.
Exactly.
We need to know how to balance it appropriately, especially in someone who's sensitive, who has autoimmune, where you
Yeah.
can easily knock them out of balance. Like, it's just knowing how to do that. So that's why I always say like that argument's a little more nuanced, but I still think I'm always going to be in the camp in favor of iodine.
I am too, Abby. And I know from my own personal experience, like, I'm probably due to actually run a full thyroid panel on myself, but because of my long-term chronic gut issues, I've eventually had to go on, support for thyroid because I've had low thyroid. And we'll talk about the gut thyroid connection here in just a minute. But like, I've noticed when I've not been taking it regularly, kind of accidentally, I was taking a test that looked at antibodies, different antibodies, but it did measure thyroid too. And
Mhm.
it did show up kind of higher than acceptable range. And it's like,
Yeah.
holy shit, we've got some Hashi's looking stuff
Mhm.
going on here. Like,
Yeah.
this is pretty compelling. I'm going to go back on it because I feel like Brownstein is proving himself
Yeah.
right. Like, just from
Yes.
my own personal experience. And
Yes.
I take a much higher dose even than you because he's kind of made the point over and over again that the higher like the higher your degree of hypothyroidism and Hashi's
Mhm.
is,
Yeah.
again, barring you have all the supportive
Yeah.
cofactors and stuff, like you can actually dose it quite high to try to titrate that down and get people
Mhm.
dialed in a little bit more,
Yeah. Yeah, absolutely.
specifically. So
I
yeah,
agree with that. Yeah,
I
and
definitely. Oh, go ahead, Abby.
I was gonna say for the listener who doesn't know, Dr. David Brownstein is one of the foremost experts on iodine. And so if you are looking to learn more about that, he is the man to listen to because he has done so much research and that's his area of expertise.
Exactly. And I think like especially when it comes to hormones, all manner of hormones, thyroid, sex hormones, adrenals, all of that, like if you're going to be taking higher doses of nutrients, iodine included and or glandulars and or hormone replacement therapy, just a
Mhm.
good rule of thumb to be checking in on all of that every 3 to 6 to 12 months depending on
Yeah.
where you're at in your life cycle and how stable your body is with what you're
Right. Get
currently doing.
tested. Make sure that what you're doing is
Yes.
working appropriately in your body. And
Exactly.
then how are you feeling? I'm always asking people like, well, first of all, how are you feeling? Like, how are things
Right.
looking? How's your body doing? And then,
Right.
okay, is that good? Yeah, great. Okay, then, maybe in 6 months, let's test and just make sure that things are going appropriately.
Exactly. No, 100%. Yeah. So I think we kind of touched on the cofactors pretty well there.
Mhm.
It's a good list of things, and not that everybody needs all of those things, but I think so much of this depends on, hey, like at least bring in selenium,
Yeah.
vitamin
Selenium would
D,
be like, I mean,
the
obviously you want your
biggest.
vitamin D to be good, and vitamin
Yeah.
C is kind of, magnesium. These are things that I take every day on a daily basis.
Exactly.
But especially if you have an autoimmune component, selenium, 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 get your selenium.
Exactly. I agree. So yeah, so there's that. Let's kind of talk about some of the root causes of low thyroid because we kind of started to hint at it a little bit with the gut stuff, but there's other things we could kind of touch on too. So yeah,
Yeah, absolutely. Yeah. So like why does this happen, right? So we talked about
yes.
nutrient deficiencies.
Yep.
Um Environmental toxins are another big one, and this really also ties into the autoimmune component, and I think this is why so many people now have autoimmune conditions in this day and age versus, our
Yes.
ancestors and in past decades because of the barrage of chemicals and pollution and environmental toxins that we are unfortunately all exposed to. And so, all hormones are affected by these chemicals called endocrine disrupting chemicals, right? And so that's your
Mhm.
sex hormones, that's your thyroid. I mean, they just wreak havoc on all of the hormones in your body. So pesticides, plastics, heavy metals, I mean, things like that, that unfortunately, we're all exposed
Yeah.
to a certain degree. These things are wreaking havoc on our hormones, and thyroid is one of those. So, the pesticides that are sprayed on all of our food, the glyphosate that's unfortunately, in the water supply, in the rain, the plastics that so much of our food comes in. Or like, you think, well, I'm not really exposed to heavy metals, but like one example is like at my house, we have well water, and
Yeah.
we had high levels of arsenic
Mhm.
naturally in the soil. So we have
Yep.
to have a filter to filter out the arsenic, like a good quality filter. So it's, you might have like lead in the pipes or lead in the paint or something like that. So it's unfortunately, there's just so much of these things in the environment that even if you're living a clean, healthy lifestyle, like you're still being exposed to a certain degree. You are still being exposed. So people are kind
Yeah.
of affected differently. But for people that already have a predisposition to autoimmune, and then
Mhm.
they have these exposures, it's kind of like flipping on a switch, right? So then they get those flares and their body flares up in response in the presence of things like environmental toxins.
Yeah, 100% Abby. And that's kind of also touching on a little bit of the just the genetic potential that's always going to be a piece of the autoimmune condition spectrum,
Mhm.
but there's a lot of correlation even between detoxification potential and that is somewhat also tied into genetics there too. If all those really unfortunate switches get flipped because of
Mhm.
lifestyle factors, because of poor diet, because of all of the things. And by the way, we can flip them the other way too. So we
We can
definitely don't come
influence
from
those, yeah.
yeah, we don't come from this camp of genetic determinism, but there is this truth that, those potentials have to be there for them to
Mhm.
express. And so, as
Yeah.
much as they can get turned on, what we're really trying to work hard to do from a functional medicine perspective is turn them back off and
Yeah.
support the body to function
Yeah.
optimally. However, one buzzword that the listener might be familiar with because it's out there a lot is MTHFR genes, right? Which is a genetic potential that helps in some part to kind of control part of the detoxification pathway, right? And so we can often see these like suboptimal detoxification potentials activated in people that then go on to develop autoimmune disease. And part of the reason why that's so correlated is because they're exposed to a lot of toxins as we all are, but their
Mhm.
bodies struggle more than maybe the average
Yeah.
optimal genetic expression to
Yeah.
effectively eliminate these things. And I mean, that could be a whole nother podcast discussion we could have down the road,
Yeah.
Abby, but like,
Yes, absolutely.
yeah, but it's just so true that like, yeah, they're everywhere. You almost can't escape it, even if you work really hard. Now you can reduce your exposure, but a lot of the truth of it is we just have to always be actively working on supporting good detoxification,
Mhm.
which
Yeah.
ultimately should support the thyroid as well from
Yeah.
an environmental toxin triggering perspective, right?
Exactly. And, and when you're supporting detoxification, you're supporting the liver, which goes back to you need the liver for most of that conversion from inactive to active thyroid hormones. So if you're
Mhm.
having, less than optimal thyroid function, you want to be supporting your liver too, because you want to make sure that it's functioning appropriately so it can have that activation happening.
Absolutely. Yeah. And one other thing I thought of as we're kind of talking about this, and this came up in my world like probably in the last 3, 4 weeks, was the reverse T3 marker that you had mentioned in the full thyroid panel can sometimes be a really good subjective clue of deeper toxicity potential. And
Mhm.
I know I had a client, more complex case working through, and I did run a full hormone or full thyroid panel, not a full hormone, full thyroid panel on
Yeah.
her And the most remarkable thing that jumped out at me, she was subclinically showing, lower values, free T3, free T4, but her
Mm.
reverse T3 was like a 25. And typically we want to
Wow.
see that 15 or less.
Yeah.
And I had already at that point had a pretty strong suspicion we were dealing with some degree of toxin exposure, toxin accumulation in the
Yeah.
body.
Yeah.
And again, we still haven't gotten that full data back. We're doing some further testing, but the point was like it can really be remarkable when you consider that toxins lead to thyroid disruption, but we can also get those clues kind of indirectly from some of these thyroid markers on a really good thyroid panel, which could
Yeah.
cause us to then think maybe we do need to go ahead and run like a total tox burden or some sort of toxin
Yeah.
specific testing to
Yeah,
get
because
some
I
more
think
data
it's
here.
pretty
Yeah.
safe to assume that we're all kind of dealing with that to different degrees, right?
Yeah,
Yeah.
yeah, exactly,
Yeah.
exactly. Yeah. So what are some other root causes of low thyroid besides toxins we can talk about, Abby?
Yeah, chronic stress is another one. I mean, what doesn't chronic stress affect? But I just want to mention the adrenal component here because a lot of times, people will so the listeners probably have heard about adrenal fatigue, when your body has
Mhm,
just been because your adrenals make cortisol, which is your stress hormone. And so when you're going through lots of ongoing stress, your adrenals are just pumping out cortisol, and it'll get to a point where that's not sustainable, right? And so
mhm.
the body will just kind of curb that off. Like, nope, we're not, it's not sustainable for me to be making this much. I'm on overdrive. I can't, I always kind of give people the example, like you only have so much gas in your tank. And then when it starts getting low, your body just it won't burn anymore. And that's where people kind of approach that burnout. So it's a spectrum of you're going through stress, you're probably really wired and you feel like you have a lot of like nervous energy. And then as you move further through the spectrum, if it doesn't resolve and you don't recover adequately, maybe then you start becoming wired but tired, where you're still
Yeah.
wired and it's hard to relax, but you're starting to feel the effects of the fatigue on your body. And if it doesn't resolve and you don't recover adequately, then you move into that just full burnout where you're fatigued, no amount of sleep is enough, you just don't feel refreshed and replenished. And so that's kind of the spectrum of adrenal fatigue. And so you I always think about adrenals when I'm thinking about thyroid because a lot of times you need to fix the adrenals before
Mhm,
you can fully fix the thyroid. And sometimes it's not even a thyroid problem, it's actually an adrenal problem. And when
mhm.
you heal and nourish and replenish those adrenals, sometimes the thyroid will even kind of fix itself. So I'm always kind of taking that into account when I'm thinking about thyroid is like, what is your stress level? Have you been through chronic stress? How are your adrenals affected? Where are you at on that spectrum?
Yeah, 100%. I agree exactly with that. And I think that's why it's often so important to kind of test both of them at the same time so we can have
Mhm.
that complete picture.
Yeah.
And then we can kind of tie this into the gut component as well, where if there's hidden stressors in the gut, whether they're pathogenic bacteria, yeast overgrowth, parasites, you name it, right? Like those can, at a low background level, continue to pump out higher levels of cortisol because the body is dealing with this
Oh,
pathogen
yeah.
load now that's going to cause a stress response, right? So
Yeah.
there's a lot of layers to this. I mean, I think in most cases with most people, there's almost always a lifestyle component jacking their cortisol up, even
Mhm.
if they have gut bugs that are doing it as
Yeah.
well. So
Yeah.
we have to often work kind of both ends of that picture. But yeah, I mean, I think it's very hard to fully correct thyroid without looking at the other parts of the HPA hypothalamic pituitary adrenal axis, right? And like
Mhm.
considering what's the ongoing stress response that
Right.
this person's
Right,
having.
exactly. We have to
Yeah.
look at that as well. And so since you mentioned gut bugs, the gut was the next thing that I was going to say. So like
Yeah.
gut health, leaky gut, malabsorption, or food sensitivities, which tie into that.
Yeah. Totally.
Definitely. So, if someone has like this is your area of expertise, Courtney, but if someone has a gut imbalance and they have that dysbiosis and then they have a lot of inflammation going on in the gut and leaky gut where those normally those tight junctions that only let nutrients through into the bloodstream from the gut are getting loose due to inflammation and
Mhm.
now they're letting bigger molecules and pathogens and other junk through the gut directly into the bloodstream where it's circulating through the body. I mean, so often that's where we get the autoimmune component happening because,
Exactly.
instead of just nutrients going into the blood like they're supposed to, suddenly we're getting toxins and the body's like got these, these poisons circulating in the bloodstream and the immune system is like, oh my God, panic, panic, panic. And if this is an ongoing thing, this is a common, cornerstone to autoimmune disease because the body has to be hyper vigilant because it's constantly being exposed to these toxins in places that it's not ready for. So yeah, definitely your leaky gut dysbiosis. And I know you want to say more about that.
Yeah, yeah. Oh, for sure. Yeah. And I think just in terms of the whole dysbiosis or just bacterial imbalance piece of the gut, like one of the more specific conditions that a client will come in diagnosed with, or we'll see a picture based on functional stool testing. So the test that I like to run often is the GI map, is just a very compelling picture of overgrowth of the good bacteria, right? We call those the commensals. They're the guys we want to see in the gut, but it's like the Goldilocks principle. We don't want too many of them showing up. We don't want too few of them showing up. And, when too many of them show up, that can start to suggest we've got them overpopulating, particularly in the small intestine, which they really shouldn't be showing up in. And that's the site of nutrient absorption in the
Mhm.
gut, right? Like where that's the long, tiny, skinny little intestine that has all of these little villi projections, these little hair-like projections that uptake our nutrients from our smallest food particles. And so if we've got bacteria in there in large amounts
Mhm.
competing for those same nutrients, often what we start to see is this, nutrient depletion picture, which can make
Mhm.
it hard then to get adequate iodine or
Yeah.
selenium or some of these
Yeah.
critical
Yeah.
cofactors, which can then drive those deficiencies that lead to low thyroid function.
Mhm.
And those types of conditions where we've got bacterial overgrowth also further things like leaky gut if they're present. Just to
Yeah.
kind of tie that back to the cortisol and HPA axis, the adrenal piece of this too, what's also common is when someone's been in that first stage of activation of high cortisol output, and that's
Mhm.
lasted for months or however long, those high cortisol levels, they will break down the body. It's a catabolic process, right?
Mhm.
Including the mucosal barrier of the gut. And so now we've got this like constant high activation of the stress response that can lead to damage of the actual bed where all of our good bacteria should live. And
Mhm.
if that
Mhm.
bed gets damaged, it's like a garden that's gone, erosion or whatever. It's gotten
Yeah.
eroded.
Yeah.
It's going
You
to be
can't grow
hard.
healthy
You
plants
can't
there.
grow plants. You
Yeah.
can't grow healthy plants in an environment like that. And the same thing can happen in the gut. And so that will always lead to leaky gut. And so there can often be multiple factors where it's hard to unpack it all and say, what was that key root thing that started
Mhm.
the whole thing?
Yeah.
But we can very, very well get a picture of where we're at by looking at a good functional stool test and sort of start to piece it out. It's like stress is probably a component. Likely you've got some food sensitivities now too. We've got these bacterial imbalances. We have to try to deal with that. And you kind of work all the threads at the same time to get things better balanced. But all of that impacts the thyroid because, as Abby said, having those food particles or endotoxin, which is a pretty immune stimulating toxin produced by certain
Mhm.
bacterial species of the gut, that will
Mhm.
leak out too. It'll get around all over the body, including the thyroid, and cause the immune
Mhm.
system to, activate and say, like, wait, we got something here. Let's go get it. And if it's
Yeah.
binding to different tissue structures, that can start that whole auto attack process that can set,
Mhm.
set up these autoimmune conditions. So
Yeah.
it is a big piece. And there's this chicken and egg component with thyroid and gut where that, let's say a person's been chronically stressed. What does stress do? It shuts down digestion, right? Like when
Yeah.
we're in a stress state, the brain
Yeah.
is like, well, it's not time to break food down and like eat a
Yeah,
meal
no,
right
we're in
now.
fight or flight. We're not in
We're in
rest
fight
or
or flight. We
digest. We
gotta
gotta
run.
escape or we gotta fight. We're not worried about
Totally.
are we digesting our meal.
Totally. So stomach acid production goes down, right? Like enzyme production goes down.
Mhm.
Those are the two that tend to drop off first, and
Yeah.
then again leads to higher degree of nutrient malabsorption because we
Mhm.
need acid and we need enzymes to cleave
Yep.
minerals and nutrients from our
Yep.
food. But then the reverse is true when thyroid goes low, we're not going to get robust stomach acid or enzyme
Mhm.
production because the whole metabolism is down regulated now. So the
Yep.
body's kind of like in this sluggish state of like, well, we don't
Mhm.
really have gas in the tank to
Yeah.
digest our meal right now, so
Yeah.
we'll kind of pump out what we can, but good
Yeah.
luck,
Yeah.
So
Exactly.
it becomes this terrible feedback
Yeah.
mechanism where
Yeah.
often I'll see digestive dysfunction also in the context of low thyroid. And that's
Mhm.
where I feel truly we do have to support both at the same time, because if we
Yeah,
can't get the thyroid well
right.
supported, it's going to be hard to get the digestion to actually come up to function like it should,
Mhm.
because the body's basically saying, like, this isn't the time to be optimizing
Yeah,
digestion. We're in
yeah,
conservation mode right
yeah,
now, right?
yeah,
So, yeah, so those are,
exactly.
and I mean, and this can translate into even the motility piece, which Abby touched on, the constipation piece of things.
Mhm.
There's even a peristaltic, like wave-like process that moves through the small intestine that can get impaired if thyroid isn't working, as well as it could be. Even just simple things like having sufficient appetite could be hard to achieve if you don't have
Mhm.
good thyroid, because
Yeah.
again, the body's kind of like,
The
this isn't
body's
just,
wise. It's like, "I'm
it's like
unprepared
wise.
for this, so I'm gonna bring down your appetite because I can't handle that much food."
Yeah. It's like a partial hibernation state. That
Yeah.
might sound extreme, but it really is. It's like the body's like, okay, this isn't the time to waste resources. So we're
Mhm.
gonna work at like 50% or whatever percentage. It's not gonna be full capacity, because
Exactly.
it's essentially kind of like a protective mechanism when
Mhm.
thyroid's down regulated. It's conservation for whatever reason, right?
Yeah.
Because of nutrient depletion, because of toxin exposure,
Yeah.
because of all of these things. So
We are hardwired to survive. We're not necessarily hardwired to thrive. Thriving
yeah.
takes a little bit of know-how and work, and we can, but just I'm always kind of reminding people that like your body is hardwired to survive, but surviving is not thriving.
Exactly, 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 Abby, and I think it's so simple, yet it can be difficult to kind of get all of these things balanced, because
Mhm.
the lifestyle component especially, that does take a little bit more work and a little bit more tools and strategy, I feel,
Yeah.
even compared to nutrition, because nutrition is, although that might be challenging for people too on some level, it's pretty straightforward. Once you have a plan and you start using it, great, you just follow that plan. Lifestyle, I find, is harder to kind of work through, because it really starts to call up, like, okay, we've got these actual like things that might be out of our control on some level. So part of this is just working with the way we perceive these stressors, so we're not having this
Mhm.
chronic
Yeah.
stress cascade happen
Yeah,
all the time,
yeah,
right?
and I feel like the lifestyle piece is something that I'm always trying to, like, insert and kind of remind people of the basic things that are just so important that we're kind of out of touch with as modern humans, and they're
Yep.
so simple that we tend to overlook them, but, the basic biohacks of, like, getting sunlight, going outside and grounding, the
Yeah.
benefits of actually feeling changes in temperature and not just always living in a perfectly 72 degrees, it's like
Yes.
our body needs that stimulation of like feeling the cold and feeling the heat and getting
Yes.
sun and all of these things, and we just think that they're so simple and they're not really built into our modern lifestyle that's pretty much all indoors in climate controlled environments in front of screens for most
Y-
people, under artificial
exactly.
lights. um but we didn't evolve that way. Going back to our, that's modern. Our tech is modern. Our bodies are not. Your body still needs sunlight. It needs a little bit of challenge in terms of cold and heat and sunlight. You need to go outside and ground. All of these things really matter. What I do find and why I'm mentioning this is when we start working on those things, which those things are pretty easy to implement into your routine. A lot of them are free, or you can find them for low cost easy access, like going to a gym that has a sauna or something, or turning on the
Yes.
cold water at the end of your shower. Like these are things that I'm implementing all the time.
Yep.
They are the things that truly move the needle in terms of the body's ability to be resilient to stress. So if you have that chronic stress piece going on and you're like, oh my god, I just can't handle anything more, it's these basics that we need to work on, like bringing back into your life, and don't discount them because they're so simple. Because honestly, as complicated as the body seems, our needs are actually pretty simple as human beings. And that's why I'm always going back to the ancient ancestor example, because it's like, what did human beings evolve with, and how can we reasonably incorporate some of those things in our modern schedules, cues that our body responds to,
Yeah.
to improve our health.
Oh, for sure, and they're so free and so simple, yet
Yeah.
sometimes people, that's where they need the biggest amount of coaching and
Right.
help
Yes.
trying to
Yes. I'm like,
implement.
it's amazing that I need to coach people on this, but at the same time, I get it because people are like, well, what difference does it make if I get 10 minutes of sunlight in the morning? I'm like, it makes all the difference. Go out and do it. Or stand at a south
Exactly.
facing window if it's winter and it's cold. That's what I do. But it makes all the difference. Think about it. Like, our ancestors, I feel like I'm saying this over and over again, but I think we as human beings need to remember this. Our ancestors lived by seasons and cycles. They lived by light and dark.
Yes.
They went to
Yes.
bed when it was dark. They got up when it was light. They did what was appropriate for the season. They ate what was appropriate for the season. That's how we as human beings thrive the best. I'm not advocating that we go and live in caves or anything. However, you can stand at your window and get 5 to 10 minutes of sunlight in the morning in your eyes, and that's going to do wonders for your hormones, for regulating your body clock, your circadian rhythm, your energy, waking you up, help regulating your cortisol. Like, we don't realize how
Yeah.
powerful some of those things are. So I'm going to get off my soapbox now.
Oh, no, no, it's all good stuff, Abby, and I'm realizing as we're kinda going through these root cause tests or root cause, like, issues to thyroid, this is probably actually another good place just to say that nutritionally speaking, sometimes people work themselves into a thyroid problem because they've gone the direction of a ketogenic or a low carb diet and ended up staying there for a very, very long time. Now, there could be reasons why they're doing that. They might feel like it helps them achieve a better body weight, and maybe it did for a period of time in the beginning, and
Mhm.
or they have gut infections and they notice when they lower carbs, it helps with the symptoms, which it can. All of these things can be true, but the problem becomes if it's too extreme for too long, that lack of sufficient carbohydrate is really hard on the thyroid. It's hard on the
Mhm.
brain too. Your nervous
Yeah.
system needs a certain amount of carbohydrates to function, and
Mhm.
so we didn't really talk about this in terms of just like specific lab markers beyond the full thyroid panel. But one of the strong clues that, thyroid is part of the whole gamut of things you're dealing with is high total cholesterol levels in the body. And that can
Mhm.
often come as a result of being on a very low carb diet, where now the body's had to kind of metabolically down regulate to
Mhm.
compensate as a
Mhm.
result of just not having these carbohydrates in there to balance things, right?
Yeah. And and that I have thoughts on this. So, because as a dietitian, I'm always getting asked, like, what do you think about low carb or keto or things like that? And most of my
Yeah.
clients are women. So I'm going to answer this in like a women focused way. But what
Yeah.
I always say is for us as women, we are cyclical beings. We're like the moon. We go through
Yeah.
hormonal phases every month, just like the moon goes through her phases. And our
Right.
needs change in each of those phases. And that means our diet and our, activity and our lifestyle needs change. So we live very much in a man focused world that's kind of like the same thing every day, the 9 to 5, Monday through Friday. Da, da, da. Their testosterone does just fine on that. We have multiple hormones at play and we go through phases and cycles. So our needs are actually quite different and they're really not in alignment with the schedules and structures of modern society. So
Yes.
what I'm always kind of preaching is that the way that we eat as women should change throughout the month. So it is certainly the case to cycle things in and cycle things out. So when people say, "Oh, what do you think about keto?" Great, I do a modified form of keto at certain times of the month, but not all month long. When I ovulate or the week before my period, I bring some carbs back in and eat more Mediterranean. This is how we as women thrive, which is quite different than the needs of men. And so I think this is such a revelation for a lot of women. So your thyroid is a hormone as well. So, I was talking in the context of sex hormones specifically like progesterone, which actually progesterone needs some carbs to be healthy. So if you're eating low carb forever as a woman, you probably are tanking your progesterone, which is going to lead to hormonal imbalances, which is
Oh
the whole
god,
new
yeah.
podcast. But
Yeah.
same thing with the thyroid. So you can still get the benefits of eating low carbs sometime, certain weeks of the month, but I would not do it just every single day, all month long, forever. Especially if you're a woman, you need to be mindful of those cycles. And that is something that I teach and that I'm very passionate about. So if this is like perking up your ears and you're like, wait a minute, I need to be like altering my diet at different times of the month for optimal health. Yes, you do. That's what I teach. So please like come join me if you want to learn more about that because I'm talking about that all the time.
Oh, for sure, Abby. Yeah, and absolutely for that hormone specific like focus, it makes perfect sense. And I know on my end, I don't necessarily do that for hormone syncing or hormone support per se, but I do end up, working with people that have to phase their diet through different stages where in the beginning we might be doing a specific therapeutic dietary approach. We might be, specifically lowering macros compared to protein and fat, maybe to
Mm,
help support killing off some bacteria or starving off some
mm,
bacteria is probably the better way to say that. But ultimately, the goal we're working towards is to help clear those infections so we can get back to better balance.
Yeah.
And I've even had, occasionally women come to me that have already been doing a low carb thing for a very, very long time, typically because they've also just recognized this is what they want to try to do to support their weight. And they feel
Mhm.
stuck because when they try to add more carbs in, they feel like they gain
Gain the
weight
weight.
quickly.
Mhm.
That's never a good sign. And
Right.
that often will come with the trade off of lower energy, more sluggishness, more brain
Mhm.
fog long term,
Yeah.
too,
Yeah.
which again points
Which is
right
not
back
what
to
we want.
thyroid. No, and a big piece of just the whole nutrition puzzle, in my opinion, for each individual, depending on what their picture is, what their main complaints are, is getting that macro balance dialed in and helping a client iterate that through their
Mhm.
entire process of
Yeah.
whether it's healing the gut or whatever it is, because it will shift as things change in the body. And
Mhm.
we just don't want these people to be in a place where they feel like they're now stuck on this low carb
Yeah.
strategy
Yeah.
to keep their
Yeah.
weight at bay or to keep their gut symptoms at bay. But the trade off is now they're tired all the time and they're struggling to think clearly and have the attention
Mhm.
they used to or the mental
Yeah.
sharpness. I mean, you shouldn't have to trade one for the other,
Right.
right? Like you
Right.
should be able to have both. And there are ways to do it. But this is where having the help of somebody like Abby or me who really understands like what is going on at a deeper level. Let's get to the root of this and fix
Mhm.
this and help you
Yeah.
get to a more sustainable place with your diet.
Yeah.
That is the goal,
Yeah,
right?
and how can we support the phase that you're at? Whether it's, a phase of healing or a phase of your menstrual cycle, if you're a woman, like
Yes.
supporting each phase appropriately and not sticking to just one thing for the rest of your life every single day, day in, day out.
Yeah.
That said, though, there's one important thing that I do want to mention that I don't think we talked about yet when it comes to low thyroid function, especially with our autoimmune component, with our Hashimoto's people, is gluten. Because if
Yeah,
there
yeah,
was
yeah.
something that you're just going to eliminate forever and never have again, it would be that. So
Yeah.
let's definitely mention the gluten piece here.
Yeah, I love that, Abby. No, I'm so glad you thought of that. Yeah, so this is a biggie. And, when I end up working with a client and whether they come to me again, diagnosed with Hashis or not, we've maybe run a full thyroid panel, we're seeing evidence of low thyroid function. Number one thing I reinforce is you have to be wheat free. And the reason why is because you look at like a lot of body of research that's been done on just molecular mimicry, right? The fact that wheat protein looks very similar to certain body tissue structures, thyroid especially. And this is a time or a point that Dr. Tom O'Brien hits home time and time again. If you kind of listen to him talk on, he's like the big like wheat free, functional
Mhm.
medicine guru in our
Yeah.
space. Like
Yeah.
it really is true. And I would say if there's
So like
any
that means the body will be attacking the weed, but
the
because
wheat
it's so structurally similar to the thyroid, it might
thyroid.
actually make a mistake, especially when it's like hyperactivated and start attacking
Yes.
the thyroid instead of that wheat if that wheat is present. So if it's not present, then you don't get as
Yes.
that same activation.
Yeah, exactly. And there's also a very high degree of correlation between wheat sensitivity and conditions like IBS, especially IBD. So all gut symptomology, I would say unequivocally, those folks too should be wheat free for life. Second to
Mhm.
that, though, thyroid issues, right? And that can sometimes be a hard thing to sell with the thyroid camp if they don't have any gut symptoms, like overt gut symptoms, because
Mhm.
I think a lot of people, when they hear the word or for words food sensitivity, they're thinking like bloating, burping,
Yeah.
belching,
Yeah.
gas, diarrhea, constipation. Yes, those can be signs, but sometimes people are having food sensitivities without like real distinct gut symptoms. And it doesn't mean it's still not like an issue. So
Yeah.
my tact with all of this is with, especially with the thyroid folks, is I just give them tons of education and links and like articles to look at. It's like,
Mhm.
you don't have to take it from me. Here's a bunch of stuff you can go
Yeah.
like
Yeah.
read on
It's
your
not just
own,
me. I
but
didn't just make this up
I
to,
didn't just make
make
this
your
up.
life more difficult.
Yeah, but it is so true. And I mean, I would almost go so far as to say, like, anyone who's had a chronic health struggle of any sort, especially if it's autoimmune and especially if it's gut symptom centric, should be 100% wheat free for life.
I
I mean,
know
that's just
gluten. I mean,
hands down.
honestly, and
Yeah.
like this day and age, it's not as hard. I mean, I've been gluten free for over 10 years. It was hard back in the day. We didn't have options. If you were
Yeah.
traveling, like forget about it, right? But now
Yeah.
it's so much more mainstream. It's so much easier. The products are better and more palatable. Like so many people are more
Yes,
informed. There's restaurants and places that are now even completely dedicated to being gluten-free or have, like separate gluten-free, parts of the kitchen with utensils and everything for those people who are just really, really that sensitive, because for those people, even just a tiny little bit can be enough to activate things, right?
for
So,
sure.
it's so much easier this day and age. So there's really no reason that you can't do it, right? I mean,
Yeah.
it's completely doable. Like any change, it might seem like a big deal in the beginning, if it's something new, but it's completely feasible.
Oh, 100%, Abby. And it's funny that we're even talking about this because, like, we're coming off of Thanksgiving. And I was just sharing with Abby before we got on and started recording this podcast. Like, I hosted this year, and my number one condition, or really my only condition, was like, it's wheat free, right? Like,
Yeah.
our whole household as a default is wheat free. I carry both copies of the celiac gene, probably have the condition. I don't want to eat 2 slices of wheat bread and go get
Mhm.
scoped for
Yeah, right.
6 weeks of that, right? To
Yeah.
get it definitively diagnosed. But like, again, using smart like thinking, why wouldn't
Right.
you proactively do that? And so for the few people that came in my extended family, I was like, the thing is, you're going to have to bring, if you're going to bring stuff, it has to be certified gluten free. That is my one rule. And they were all
Yeah.
willing to do it. And then, of course, we made the majority of the food, which again was totally fine. I enjoy that. And it's fun to share new recipes. And it became a bit of a talking piece at our dinner table. It's like, well,
Mhm.
if you don't use regular flour for dinner rolls,
Yeah.
what
What
are
do you
you
use?
what do you use? And so it
Yeah.
was kind of
Yeah,
an
and I feel like
interesting.
that's,
Yeah.
that's often such a barrier to people, and that's such a good question. If you don't mind, I'm
Yeah.
just going to mention, like,
Yeah.
recently on my podcast I had a gluten-free chef
Oh,
on.
yeah. Yeah, yeah. I remember you telling me about that,
Yeah,
Abby.
Jasmine Fulwood is her name.
Yeah.
And she actually makes gluten-free products for like cornbread and cookies and things like that. They actually taste amazing. You can't even tell they're gluten-free. But I had her on because I wanted to help educate people, like especially for the people who are like faced with this, okay, you need to eliminate gluten from your diet. And they're like, oh my gosh, I'm so overwhelmed. Like, what do I do? So having
Yeah.
a resource like that. So if anyone is kind of thinking like, oh, that might be me, I need some help, like definitely check out my episode with Chef Jasmine Fulwood, because we like dove in on how do you make those changes in your life, because that's her area of expertise.
Yeah, and I can actually link that too in the show
Oh,
notes.
that
And
would be
it's
wonderful.
there. Yeah,
Yeah.
yeah, yeah. Easy
Yeah.
to do, Abby. Yeah. So no, 100%. I think it's less about knowing what to do. A lot of people, honestly, this isn't the first time they've heard that. When it's one of the first things I will start to, have clients do dietarily. Because again, most of my clients have gut issues. It just makes sense. And a lot of times they'll nod and be like, oh yeah, yeah, I know that, or I've done that. But it's that, how do we do this and then maintain this easily enough that it becomes a
Yeah.
lifelong habit? And so it's more the behavior change component. Sometimes too, they still have pieces of that puzzle. They haven't gotten full support and strategy
Mhm.
developed around, like, for example, if they travel, what do they do? Right. And,
Yeah.
there too, there's actually some amazing supplements out there that this is something I commonly recommend to clients. Go get a bottle of gluten degrading enzyme. You can keep that in your purse. And when you do
Yeah.
travel, it's simple enough just to pop a couple of those in when you have a meal, and it can really help to like break down any accidental wheat exposure before the immune
Yeah.
system sees it.
Yeah.
So,
Keep yourself functional and in
yeah.
balance while you're traveling, even if you
Yeah.
are exposed, right? Yeah.
Right.
That's such a
So,
good point. Yeah.
yeah, it doesn't have to be an either or. And I think that's where people get really paralyzed. And maybe even
Mhm.
if they're in that space of considering working with someone like you or me, Abby, I think sometimes the fear is, well, how the hell am I going to live a normal life?
Yeah.
Because I kind of know enough now to know I'm going to have to make all these changes, but I'm scared to do that and then maybe
Yeah.
even feel better. And then how do I maintain this for the long haul? Because everyone around me is still
Yeah.
doing their typical thing.
That makes
Totally
sense.
get that. That's a very common situation that we help clients deal with. And you really can live a normal life. You just have to have some very good tools and strategies mapped out and in
Mm.
place so that when these situations arise, you know exactly what to do. And that's where
Yeah.
the whole coaching and strategy development could be so hugely helpful and really be the
Mhm.
thing that gets people over the hump,
Yeah.
especially if they've kind of dabbled in this or dabbled in that themselves and they've made these changes for short periods of time and seen benefits, but then kind of fallen off the wagon, so to speak, right? Like that's so
Mhm.
common.
Yeah.
It's because it's really hard to really know all of the things to maintain this as a lifestyle without getting that kind of guidance and coaching from a really knowledgeable practitioner, I
Yeah.
think. Yeah.
100%. I agree with that.
Yeah. So, well, this is probably a good place to wrap because we've talked a lot about thyroid and all the things thyroid, and of course, we've gotten into the gut, the
Yeah.
hormones. We didn't really touch on the Dutch test, but we might just do an episode down the road on, all the things you can glean from the
Yeah,
Dutch
yeah,
test.
absolutely. That would be a wonderful episode. You guys stay tuned for that.
Yeah, absolutely. And as we've said before, Abby will be coming back on as a regular guest, on the podcast, talking about all kinds of things that I'm sure will be super interesting and amazing related to health, gut, hormones, the whole nine, right?
We always get into it.
Exactly.
Yes,
All
we do.
right,
And I
Abby. Well,
enjoy
it
it
was a
every single time.
yes, and it was a pleasure having you on as always,
Thank
and
you, Courtney.
we'll have you back again soon.
Did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.